Hello, and welcome to Talking Health with Bumi. Today we are focusing on one of our most essential yet often overlooked senses, our eyesight. Whether you are staring at a computer screen all day, spending time outdoors, or noticing changes in your vision as you age, eye health impacts all of us. Our eyes are constantly at work, yet many of us don't give them the care they deserve. So in today's episode, we'll explore how to protect and maintain our vision. From understanding common eye conditions to preventing digital eye strain and debunking eye health myths. I'll be speaking with a professional ophthalmologist who will share tips on how to keep our eyes healthy at every stage of life. There's no gainsaying it. There is no how we can address all the re's or the rats now within the very limited time we have. But I'll try to engage the doctor on the concerns I've received from some of you, my dear viewers. So stay with me. You won't want to miss this eye-opening conversation.
Your smile is your signature. It's unique, captivating, unforgettable. At Smile 360, we understand that excellence is in the details, and every detail here is designed with you in mind. From personalized care and cutting-edge technology to a team of world-class experts, we bring the artistry and precision that your smile deserves. Because true luxury is not just in the experience, but in the results, a smile that radiates confidence and beauty. Discover a new level of dental excellence. Discover Smile 360.
So to do justice to this eye matter is no other than Dr. Funmilayo Oguntoye. Dr. Oguntoye is a consultant ophthalmologist and head of department at Randall General Hospital, Surulere, here in Lagos. Welcome to the show, Dr. Oguntoye. How are you today?
I'm fine, thank you. How are you doing too?
Great. I'm happy to have you on the show. Okay, so let's kick off with some basic eye, health and vision care. When do we say someone is having sight challenges?
It has eye challenges. It can be a whole lot of things. It's not a one jacket fits all, but commonly you would hear people say their vision is blurry or they have reduced vision or poor vision. Then sometimes they may say they have redness in their eyes, they have pain, they have some gummy discharge, or basically they can't see clearly whether during the day or at night, and a whole lot of others. In terms of putting conditions to the different eye challenges a patient might face, commonly we talk about cataracts. Cataract is the commonest cause of reversible loss of vision. So when we're talking about, someone's vision is reduced, there are different causes, and basically we can group it into the reversible causes and the irreversible causes. So when we're talking about what we can reverse, cataract tops the list. And what is cataract, for example? We say that the lens in the eye that is supposed to be transparent is now opaque, that is now cloudy. So the aftermath of that is that patient's vision will be blurry. Patient may say, I see like a Harmattan haze, or my vision is cloudy, or is blurry, or whatever, adjective they want to describe. They want to use to describe it. So cataract, that's one. Another thing that patients have commonly is what we call refractive error. So what does refractive error mean? It means that the rays of light coming from whatever objects an individual is looking at is not being focused. The different types, it can be short-sightedness, what we call myopia. It can be long-sightedness, what we call hypermetropia or hyperopia. And it can be astigmatism. So in simple English, what these different types of refractive error, what they mean is that the rays of light coming from the objects an individual is trying to look at is not being focused properly at the back of the eye. So when it is focused in front of the retina, that's what we call short-sightedness. And such an individual will see what is clear, will see what is near clearly, but then struggle to see distant objects. So we need to give, for example, maybe spectacles to help focus the image on the retina. There are other options. You can also decide to use contact lens. Some people may also benefit from some form of refractive surgeries, and the rest. If the patient is long-sighted, that means that that patient can see what is far away clearly, but then when it comes to seeing what is closer, such a patient struggles. So also we can use lens, we can use spectacles, glasses to correct, that kind of thing. Usually to be the plus type of lenses that we're going to put in the frames. For the short-sightedness is usually the minus, powers. The long-sightedness is the plus powers. Then for astigmatism, so what that means is that when a patient is trying to view an object, is not forming a pupil at the back of the eye. Rather, it is forming a line focus. So in simple English, such a patient may tell you that maybe when they are reading or when they are looking at an object, it appears slanted, or, curved or wavy, or they may appear to skip lines when they are reading. So normally when you are reading, you're supposed to go from one line to the other, but it may be as if, they are skipping lines as they read. Or maybe when they want to write, they're not writing on a straight line. It could just be because the images is not being focused at a point, rather it's forming like a line. And usually we use cylindrical lenses to correct, that kind of refractive error. Other conditions that a patient may have would include glaucoma. That's also quite common. But unfortunately, glaucoma is irreversible, meaning that whatever damage that has resulted from glaucoma, one cannot turn back the hands of time. And that's because there is a cable wire at the back of our eyes that connects the eyeball to the brain. It is that cable that is responsible for transmitting impulses to the brain. And that cable or that nerve is called the optic nerve. That is what is responsible for our vision. So if a patient has glaucoma, fibers from that optic nerve, they are being affected. And because we know that this nerve does not grow back, that's why glaucoma is irreversible. So the best thing for glaucoma is early detection. The earlier it is picked, the better it is for the patients. Fine, there are things that we use in the clinic to help manage glaucoma, but all of these things they don't give a permanent cure. So it just keeps it at bay such that we don't have further deterioration, which would amount to loss of vision. So glaucoma is irreversible, and that's quite common, especially when we talk about we Black. There are some risk factors that may predispose someone towards having glaucoma. So we have things like genetics, So if there is a family history, for example, of glaucoma in your first degree relative, that is your parents or your siblings, such a person has a higher risk compared to someone who doesn't have a family history. But then we shouldn't forget that in a country like ours, going for routine eye check or even routine, general body check is not as common as what we have in the developed countries. So a lot of people would tell you, there's no known family history of glaucoma. It could just be because they have really not checked, because people don't really go for the checkups and all. So we don't just take it hook, line, and sinker. If you don't have a family history, you cannot have glaucoma. No, it's not like that. So we now take it further, not just asking for family history. We ask if there's any history of blindness. Remember I said that glaucoma tops the list when it comes to causes of irreversible blindness. So even if we know our uncles, our grandparents, our great-grandparents in the villages and all, they may not have access to, eye care, or maybe while they lived, they never really checked their eyes. But the simple information of, my great grandma or my maternal uncle or whatever it is happened to go blind before he or she died. You understand? That's part. Oh, okay. There's a positive family history of blindness. We can't really say whether it's glaucoma or not, but then we note that kind of thing down. So other risk factors, apart from the family history, we talk about advancing age. So the older we get, the more at risk to developing glaucoma. And that's just simply that is because the structures in our eyes too, they are also aging just the way we advance in age. When you see a 10-year-old, a 15-year-old, you should see them they can twist, they can, their body is still very flexible and all that. So in the eye, for example, we have like a drainage channel. So like a sink. Let me just use that, simple analogy to explain it. So it's supposed to filter to help. So normally fluid is being produced in the eye, but the fluid that is being produced also drains out, it gets filtered out. So sometimes as we get older, the drainage channel is not as, it doesn't filter as much as, it doesn't drain as much as it was when we were much younger. And that could be because of, some deposition, some aging process, some of the cells there and all that, you have some rigidity happening and some deposition, of, some other things. And also the drainage is not sharp. Let me use that local or the street language to explain it. So, you can have buildup of pressure, from that. And when pressure builds up in the eye, it further compromises that structure at the back of the eye. Though it is not sacrosanct that everybody that has glaucoma must have increased eye pressure. However, increased eye pressure is a risk factor. So sometimes we check your pressures when you come to the clinic. It's one of the things that you should actually, the doctor or whoever you see in the clinic is one of the routine the eye pressure. So there are several instruments in clinic that we use to know what your eye pressure is. So usually the normal is between 10 to 21. So there's a range. So it's not like it's one figure fits all. So the average acceptable range is between 10 and 21. But then even if we check your pressure and we're getting 16, we're getting 18, it's not good enough to say, oh, your pressure is within normal, and so you do not have glaucoma. No, because there's what we call normal pressure or normal tension glaucoma. So a lot of people, their pressure never rises above normal, but then you have these definitive changes happening at the back of their eyes. You cannot say they don't have glaucoma, and that's why that subset of normal pressure or low pressure or normal tension glaucoma, those are all synonyms just to describe that your pressure is within normal. However, you have characteristic changes that we cannot overlook. And so such a patient will still need to be treated so that we don't have further damage happening to that cable I mentioned earlier that is at the back of factors. Would include, let's say, the black race, for example, race generally. So there are types of glaucomas. We have the primary type, we have the secondary type. Primary type, you can't nail it to a particular cause. You understand? Just where you have primary hypertension, you can't really say it's because of this. That's why the patient has this. Then there's the secondary type. Secondary is because something happened for that person to develop this. So yes, sometimes glaucoma can be secondary. I mentioned cataracts earlier. You can also have some cataracts arising as a result of some other things. I didn't say that. What is topping the list in terms of causes of cataracts? We talk about old age, advanced age. So as we get older, the lens will also continue to age. Just the way our hair will start turning to gray as we are approaching 50, crossing 50, going to 60, it's an aging thing. One can't stop that. So also the lens in the eye to be transparent like glass too will start to become cloudy. However, when we're seeing cataracts, in a younger person, we are thinking, what are the things that can cause this? It can be from trauma, injury, somebody that has had injury, to the eye or to the face before, as simple as a slap onto the face, can give a person cataract, or a punch on the face, or some penetrating injuries that get into the eye, maybe a nail, a pencil, any form of injury can cause that. Inflammation too can also cause that. So maybe some people can have this redness, their eye is bringing out water, is painful, is overly sensitive to light and all. So all those inflammatory changes happening in the eye can also make that kind of a person develop cataracts, for example. Sometimes we even have cataracts in children. It's not just limited to adults. Some children are even born that way. A couple of weeks after birth, you see that they have cataracts, when they examine, and they're wondering from where.
Wow. I'm so happy that as you were saying the problem, the challenges, you're already saying the causes alongside. Doctor, you said so much, so let's just take a quick break and we'll be right back.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back. Okay, so doctor, I want to ask you, because you've said so much, within the time frame we have spent. A lot of time, we've heard there are a lot of myths, and you already touched on a couple of them. But there's this particular one, people tell you that don't read on your phone or don't watch TV in the dark. Okay, so I just want to ask, is it true that reading in low light or watching TV in darkness, is it by any chance harmful to our sight?
Yes. So now that reading clock is a very important thing. And for example, for children, we realize that a lot of children are getting more short-sighted now because of the gadgets they're always using. If we wind back to 20 years, 30 years ago, most children go outside to play. When it's playtime, it's either you're playing with your toys or you're out there actually playing football, playing 10-10, playing whatever. You're not having to look at something close. Unlike what we see nowadays, most of our children are restricted. When they are in the house, they want to screen time, they're carrying iPad or, watching and all that. So because as they are growing, for example, their eye is also growing. So the fact that they are exposed to outdoor activity, it helps them to even see what is far and intermediate compared to just having to read close up, which can help them, which can tilt them towards being short-sighted. So screen time is something that we actually have to work on now, and we have to be conscious as parents, as guardians. It's not every time, check my phone, take my iPad, let me have peace of mind so I can do other things. You can encourage them to play with actual toys, play outdoor, just run around or do whatever they need to do. And when it comes to in the dark, so the thing is, it's good when you're trying to read or you're working and the environment, the illumination of your environment matches that from your screen, because it helps to, it doesn't put a lot of, stress on your eyes. So what happens is that when I'm reading in the dark, the room lights are off, my curtain is down, and I'm looking at the computer or the iPad, all the rays coming from that computer is going into my eyes, and it can stress my eye, it can make me more fatigued, it can even predispose me towards having more dry eye symptoms, basically because I'm staring at a screen for longer than usual, and the ambient light does not match it. So it strains my eyes more, it makes me more fatigued and all that. So the advice is that as much as possible, let the light from your screen, let it match that of your environment. So if you're in a semi-dark room, you can then turn down the light from your computer or from your gadget so that it kind of matches. Everything just balances. You can just do a quick check where you are now. Turn off the light in your room, put down the curtains, and then light. It's just all too much for your eyes. Your eyes also needs, some to be comforted. Let me put it that way. So let the light from the environment match whatever gadget you're using. Try to blink more often, because what happens with gadgets is that because we are trying to finish up whatever we are reading or we are watching a film or whatever, we tend to blink less. And there's a particular number of times we're expected to blink. Each time we blink, you have tears go over the front part of our eye, and it helps to lubricate it, helps to keep it, moist. And that's because the front part of our eye, that's the cornea, is responsible for bending the light rays that is coming from outside. That's the first thing that bends the light rays before the lens bends it and then focuses it at the retina. So if your cornea is dry, from blinking less often and all that, it would also cause some blurriness, your vision is not so sharp, and sometimes some patients can have some sandy sensation, some grittiness in the eye, some actual itching, some can even tear more than they're supposed to. Those are all like signs and symptoms around dry eye. So there's something we call 20-20-20 rule, which simply means for those that use that use gadgets a lot, screens, we advise that every 20 minutes of using any digital device, take a 20 seconds break and look 20 feet ahead. So in a 1 hour period, you have taken 3 conscious breaks, each lasting 20 minutes.
Say that again, 20-20. I want to understand. Please, can you say that again?
20-20-20 rule. 20-20-20 rule. It means every 20 minutes of using a gadget, any digital device, your phone, iPad, computer, take a 20 seconds break and look 20 feet ahead. 20 feet ahead can just be like across the window of a standard room. So if you're practicing that, it means that in a 1 hour period, you have taken 3 conscious 20 seconds break, and that would help give you some relief in terms of some of these digital eye strain complaints that patients may have.
Terrific. My last question before I let you go today, doctor. Thank you so much. My last question will be, a lot of people say, no, I'm not wearing glasses. By wearing glasses, you worsen your sight condition. Is this a myth or is it true?
No. Wearing glasses does not worsen the condition of your eye. And this is what I usually used to explain to patients. So just imagine you are in a cold country. It's winter. And so you have your winter jacket on to keep you warm. The moment you pull your winter jacket, you are back to it. You are going to meet the cold, right there. So basically, wearing glasses helps you see better when it is on, and it doesn't worsen it. If the need for your glasses changes, maybe after 2 years or 3 years, it's because the things that are happening in your eyes is also changing. Like I said, for a child, for example, the eye is growing. The child is 2 years old, the child is 5 years old, the child needs to wear glasses. The child will not remain on that power forever because the child is still growing. Just the way the child is growing in height and all that, the eye too has some changes that is happening. So there will be a need to have it changed. And for an adult, for example, the way you're also getting older, that's also the way the structures in your eyes too, they're also changing. So the need, your power is not, it doesn't remain stagnant. It flows along with the need. Do you understand? So it's not like it's the glasses that is worsening your eyesight. The glasses doesn't worsen eyesight.
Okay.
It helps improve your vision when you have it on your face. And if the need for your lens power changes, is because there are also changes in your eye, which is not caused from the glasses. You just need to understand that.
Yes, thank you so much for those invaluable inputs. I mean, it's more than what I bargained for. You really, really lectured us today. The eye, they say, is the lamp of the body. How bright is yours? You heard the doctor advise that if you're the type that spends a lot of time on the screen, you must learn to practice the 20-20-20 rule. That is, after 20 minutes on the screen, take a 20 seconds break and look 20 feet ahead as a measure to keep your eyes healthy. That's just one of the several tips the doctor gave us today. You can't afford not to see this episode again and again. It's indeed eye-opening. Well said. By no means will I close this show today without reminding you of the whopping 25% discount Konga Health is dangling before you this period. That is, if you're a distributor, or 20% if you're a retailer or an ordinary consumer like me. Come on, what are you waiting for? Grab the most original skincare product from Konga Health today. You can't get it juicier anywhere else. Right, we're still in the Yakata season and doling out original products at 80% discount on Konga.com. Don't miss it. And that's how I wrap up today's edition of Talking Health with Bumi. Don't forget to subscribe if you have not already done so, like and share. Until I come your way again, think health matters. Think Talking Health with Bumi. Bye for now.